Welcome, everyone. My name is Dr. Adam Riker. I am a surgical oncologist currently practicing in Annapolis, Maryland, which is in between Washington, D.C. and Baltimore. I'm the chairman of oncology for our cancer program, and I'd just like to give you an overview of the the upcoming masterclass that I'll be presenting. In summary, first I'll just go through a few bullet points. I'm going to talk about the statistics of melanoma, and indeed that's the title of my topic, is the current surgical management of melanoma in the United States. So first I'll start with some statistics, both in the United States of incidence and mortality, and then I will go into the same for Australia. And then I will talk about what causes melanoma, in particular, what are some of the risk factors for the development of melanoma. And then I'm going to go into the diagnosis and doing a clinical examination. This is not going to be detailed in terms of dermoscopy. That's the topic of a separate presentation. What I'm going to really talk about is doing a full body skin examination and what are some of the common things that you want to look for using the very simple ABCs, which I'm sure you're all familiar with. And then I'm going to start to talk about the different types and subtypes of melanoma and where they occur on the body, and then go into the clinical and pathologic staging that will be based on either the shave biopsy or the incisional biopsy, the excisional biopsy, or the core biopsy. Most of the talk I will then talk about the surgical management of melanoma. And here in particular, I think it will be quite useful because I will go over what I would consider something that can be done in the office under a local anesthetic, and then what really should probably be referred to a surgical oncologist or somebody who has expertise in the surgical management of melanoma for the early stage, but more advanced stages of melanoma that require other surgical techniques such as sentinel lymph node mapping. So I will begin and start with melanoma in situ, and then we will work our way through utilizing the Breslow depth of invasion to first talk about how to manage surgically a thin primary melanoma, intermediate thickness melanoma, and then we'll do thick primary and late stage melanoma at presentation. And then I'll talk a little bit about the role of sentinel lymph node biopsy, and again, to be able to differentiate what can be truly managed in the office and really highlight some of the nuances and differences between how we manage skin cancers, in particular melanoma, in the United States, and then compare that to current management in Australia. And then I will talk about a few clinical scenarios of some special subtypes of melanoma, such as a subungual melanoma, or I will also talk about the amelanotic melanoma and a few other of these special subtypes of melanoma, and even a Merkel cell melanoma, Merkel cell carcinoma. And then lastly, I won't spend too much time on this, but I'd like to talk about some of the cutting edge therapies and personalized therapies and immunotherapies for advanced stage melanoma, and sort of end it with that. So I really look forward to having everyone attend the class, and I look forward to meeting everyone and talking about this interesting topic of the current surgical management of melanoma in the United States. So thank you.